Thank you, Madam President. Thank you, Senator Hyde-Smith, and thank you, Senator Lee, for both organizing this colloquy and participating in it in support of the Support and Value Expectant Moms and Babies Act. I love that title, Support and Value Expectant Moms. Isn't that great? We should. I'm a doctor, not an obstetrician, but nonetheless have delivered babies. And as a doctor, my mission was to save lives. I don't practice anymore, I use past tense, was to save lives and improve health outcomes for all patients. We're here talking about chemical abortions. Chemical abortions don't do any of that. The health risk can be severe, obviously for the unborn child, but also potentially for the mom. And particularly when the mother has this without supervision by a healthcare provider. The total absence of medical support is the total absence of care. And using potentially dangerous chemicals without medical support can lead to the absence of health. If Americans care about a woman's health, they should be concerned when such procedures are allowed. Yet chemical abortions are on the rise. I'm told in 2017 they represented nearly 40% of all abortions. And due to a recent court case, women can begin to receive these through the mail, prescribed without receiving a physical exam even. Now, the mom who kind of selects that may not know the potential consequences, but as a physician, I do. The potential complications include, for example, if the mother has what is called an ectopic pregnancy. The unborn child and the placenta are not in the womb, but they're outside of the womb. If that occurs and these pills are taken, the pill known as Mifeprex, RU486, it can cause that pregnancy to rupture. And instead of the bleeding coming out as a child would through the vagina, it means that the internal bleeding occurs, which can result to the mother's death. Chemical abortions have 4 times the complications as surgical abortions during the first trimester, and as many as 6% of women taking these abortion drugs require surgery to complete the abortion, potentially painful and life-threatening, and of course, horrific for the unborn child. The American College of OBGYN has stated that, quote, compared with surgical abortion, medical abortion takes longer to complete, requires more active patient participation, and is associated with higher reported rates of bleeding and cramping. The bill we're discussing today, the Save Moms and Babies Act, or the Support and Value Expectant Moms Act, takes substantive steps to protect the health of women and the unborn child. The bill prevents approval of new abortion drugs by the FDA, keeps the Risk Evaluation Mitigation Strategy, or REMS protocol, and curtails abortion pills from being dispensed by mail or through telemedicine. I introduced the Tele-Abortion Prevention Act of 2020 in February that requires a doctor to physically examine a pregnant mom before prescribing any abortion-related drugs and requires a follow-up appointment. We actually want women to receive health care by health care providers who care about our health. If senators in this body really care about a woman's health, they should join with us to stop these do-it-yourself abortions. Preventing abortion protects unborn babies, but preventing chemical abortions protects women. Let's work together to protect women by passing the Save Moms and Babies Act to forever end dangerous chemical abortions. Thank you. I yield back.